The guidelines for infection control for regulated health professionals was developed by many health professionals, not just in the massage therapy industry, but the chiropractic industry, the physio industry, all the health professionals, to give us some guidelines to our safety in our clinic. There's a couple of things that it does talk about. I'd recommend that you log on to the website to review this infection control guideline. But we're going to just review it just very, very briefly today.
Yep, some of the things it talks about is how you can protect your personal safety as a health professional, the things that you can do for yourself to protect yourself.
Yep. Also the preventing the spread of infection indirectly between people.
So between you and your client, or between your previous client, or the people in your waiting room.
It also discusses the prevention of spread of infection by tools or equipment that you may be using in your practice.
And prevention of spread of infection by other sources in your environment. Things that may come into your environment that could have germs and bacteria on them. So those are sort of the four segments of what it teaches you.
This document also gives you guidelines to help you identify the following.
Proper hand washing and sanitizing, which people think is it's simple, it's common sense. It's really not. So they're educating us on how long you have to be washing and what you should do to sanitize.
Mm-hmm. Utilizing personal protective equipment when it's indicated.
So for example, as a massage therapist, wearing latex gloves. If you're massaging somebody who may have a skin disorder or something like that, you're wearing protective gloves to protect yourself.
Or latex-free gloves.
Latex-free gloves,
mm-hmm.
Sorry.
There's also proper cleaning and disinfecting of tools and equipment, which we've gone through.
Proper waste management. So just the best way to remove things that you need to get out of your clinic that may be infected.
Now we're going to talk about the common chemicals that we use in our home and also in our clinical environment that can be possibly very toxic to our environment.
In the 1960s, a UN-based International Agency for Research on Cancer looked into all of the chemicals we do use in our home and made a list of the potential carcinogenic chemicals that we have in our household.
So the following is just a small list of typical household items that we do use every day that have been found to be carcinogenic. So plug-in air fresheners tend to have a chemical called formaldehyde, which is a carcinogen, and it forms when it comes in contact with electronic air cleaner or excess ozone in your home.
Powdered cleansers contain silica, which is finely ground quartz, carcinogen, when in the powder or dust form.
Powdered laundry detergents contain NTA. It's a possible carcinogen, and it's environmentally harmful replacement for phosphates.
Many spray cleaners, degreasers, laundry detergents, carpet stain removers contain NPE, which disrupts the actions of hormones in our bodies.
Typical window or glass cleaners, all-purpose cleaners, any kind of spot removers, silver and jewelry polish can possibly contain ammonia and ethylene glycol, which can be inhaled or absorbed through the skin, and it is found to be a toxic compound, and they advise never to mix it with chlorine.
Laundry bleach, laundry detergent, dishwasher gels and powders contain chlorine bleach. Chlorine used in making the bleach is toxic, and the bleach itself is acutely toxic to fish.
Automatic dishwasher gels and powders may contain phosphates, which can cause severe algae growth, choking our lakes and rivers.